In July 2014, one of the world's deadliest viruses descended into one of Africa's largest cities, Lagos. Approximately 21 million people, one international traveler, and a physician who refused to open a door is how Nigeria stopped this deadly virus. What up, African world? It's Home Team here, and welcome back to another video of African history, culture, and worldview. My team and I have been doing our best to include animation and motion graphics in our videos. It takes a lot of effort and resources to do animation, and so with the support of our patrons, we can continue working with Playwatch, the studio producing these animated videos. This channel cannot continue producing this kind of animated content without your continued Patreon support. Additionally, if you're interested in your own animated content and would like to work with Playwatch, their link along with Patreon's is in the description box below. Ebola is a very dangerous virus. It spreads through contact with bodily fluids like vomit, blood, or sweat. If one discovers it early and isolates the patient, its effects on the populace can be greatly ameliorated. However, one small error can make it spread, having a devastating effect on a crowded city like Lagos. By mid-2014, West Africa's Ebola epidemic was accelerating, and on July 20th, 2014, a visibly ill traveler from Liberia landed in Lagos and was taken to a private hospital. His claim was that he was suffering from malaria. He further revealed that he had just lost a family member to Ebola. Given this information, his self-diagnosis was a bit suspicious, and in a city this dense, one minor overlook can be catastrophic. Interestingly enough, at the time, Nigeria's doctors at government hospitals were on strike, pushing more patients to private clinics. At First Consultants Medical Center, a senior physician named Dr. Ameyo Stella Adadevoh examined the traveler and started asking him different questions. Despite his claim, Dr. Adadevoh sagaciously recognized a pattern of symptoms and recent travel history that painted a clear picture. She raised the alarm immediately. Isolate him now. The pressure was mounting as officials affiliated with the patient's home country wanted him discharged to attend a regional conference. However, Dr. Adadevoh refused for the greater public good. She ordered isolation, alerted authorities, and bought time for Nigeria to mobilize. When dealing with a deadly disease like this, time is critical. That single decision closed a window for the proliferation of a deadly disease into one of Africa's megacities. Within days, Nigeria activated an emergency operations center, a multi-agency incident command modeled on polio work, linking surveillance, labs, logistics, and contact tracing across Lagos and beyond. Think of it like a command center: doctors, labs, phone lines, drivers, data people, essentially everyone in one room. They traced every person who had contact with this patient. They called them every day for 21 days to check for fever. If someone felt sick, they were tested fast and isolated. Investigators ultimately traced 899 contacts across Lagos, Port Harcourt, and Enugu. In a megacity where rumors can spread faster than a virus, the response fused hard epidemiology with public communication and rapid coordination. Due to her one decision and brilliant reaction time, at its peak, Nigeria counted only 20 Ebola cases and 8 deaths. In medical terms, that's the difference between a spark and a wildfire. On October 20th, 2014, after 42 days with no new cases, the World Health Organization declared Nigeria Ebola-free. Nigeria's outcome became a global case study: speed, structure, and trust, all triggered by a clinician who said no. This one woman saved so many lives, not just in Nigeria, but likely beyond. Unfortunately, Dr. Ameyo Adadevoh paid with her life. She tested positive on August 4th and died on August 19th, 2014. Colleagues and other health workers were among the victims as well. Her family created the DRASA Health Trust to carry forward her legacy of infection prevention and health security. This wasn't luck. Analysts point to a handful of decisive moves: rapid isolation, unified command, aggressive contact tracing, and public risk communication. You don't often hear of an African country with a megacity held up as an example in an epidemic. But that's exactly what Nigeria became. The lesson isn't about labs or logistics. It's about courage at the edge of uncertainty. One physician, one decision, and a system ready to follow through. In 2014, Nigeria stared down Ebola, and at the door stood Dr. Ameyo Adadevoh. Well, I'm all out, guys. If you like these videos and want to help in its continued production, support the home team on patreon.com. The link is in the description box below. Know thyself. Remember your ancestors. Peace.